Good evening. My name is Isidro Figueroa. I'm with the Community Development Department. I will be presenting a consideration to include medical clinics and hospitals as a sensitive use requiring separation from businesses engaged in the sale of firearms and ammunition and firearm ranges. I would like to provide some background on the subject. On July 16th, 2019, the City Council unanimously voted to adopt Ordinance 2961, referred to as the Firearms Ordinance. The zone text amendment outlined where firearm retailers and firearm ranges could be located and established a permit process for the review of new firearm businesses, which require approval of a special use permit. The zone text amendment did not regulate firearm ownership, private use, or an individual's ability to purchase firearms or ammunition. During the public hearing, the council deliberated on the possibility of including hospitals and clinics as a sensitive use. Public testimony urged the council to consider clinics and hospitals as sensitive uses, citing a patient's safety and security should be protected equally as the sensitive uses being considered under the proposed ordinance. Firearm ammunition sales and firearm ranges require a minimum 600-foot separation from any sensitive use. Council directed staff to research the potential inclusion of medical clinics and hospitals in the ordinance and report back at a future date. The Oxnard City Code does not contain definitions for medical clinics and hospitals. Using best practices, staff outlined the following definitions to guide discussion. Medical clinic means an organized outpatient health facility that provides direct medical, surgical, dental, optometric, or podiatric advice, services, or treatment to patients who remain less than 24 hours and that may also provide diagnostic or therapeutic services to patients. Hospital means a health facility having a duly constituted governing body with overall administrative and professional responsibility and having an organized medical staff which provides 24-hour inpatient care, including one or more of the following basic services: medical, nursing, surgical, anesthesia, laboratory, radiology, pharmacy, dietary services, or psychiatric care and treatment. The medical clinic definition is not intended to include land uses such as, but not limited to, medical insurance and medical services, retail medical equipment and supplies, pharmacies unless ancillary to a medical clinic or hospital, medical research and laboratories unless ancillary to a medical clinic or hospital, medical devices, equipment, and hospital supply manufacturers, ambulance services, veterinarian services, and spa and wellness centers. Firearms-related businesses must maintain a 600-foot separation from sensitive uses. Sensitive uses are non-residential daycare, child or adult, parks, churches, public or private schools, any residential zone properties, Oxnard Transportation Center, and the Oxnard Airport. A 200-foot separation is required between individual firearm-related uses. Based on the proposed definitions for medical clinics and hospitals, staff plotted clinics and hospitals on the previously approved buffer map under Ordinance 2961, which is the map before you. Over 290 medical establishments were plotted based on the city's business license rolls. The map identifies the zoning areas, designated in red and orange, throughout the city that allow firearm sales uses under the current firearms ordinance. The green dash areas identified all of the areas where firearm sales uses are allowed if hospitals, clinics are included as a sensitive use. Map 2 contains a map that identifies all sensitive use buffers, including medical clinics and hospitals. The current baseline is approximately 1.57 of the land area in the city where firearm sales uses are allowed to operate. Potentially, if medical clinics and hospitals are included as a sensitive use, the available land area where firearm sales uses are allowed would be reduced by 0.38% to approximately 1.19%. The Community Development Department staff consulted with the City Attorney's Office and Police Department and determined inclusion of medical clinics and hospitals as a sensitive use would provide for a legally sufficient number of parcels to accommodate firearm uses. If directed to pursue a zone text amendment, this report would be the first step of a public engagement process to amend the Oxnard City Code to include medical clinics and hospitals as a sensitive use. The following is a projected roadmap for amending the current firearms ordinance. Hold a community workshop, continue engagement with the 4 existing firearms and ammunition retailers. Previously, there were 6 firearms and ammunition retailers. However, Walmart and Dick's Sporting Goods ceased all sales of firearms and ammunition due to their national policies on the subject. Hold a planning commission public hearing, which would be a recommendation to the city council, and hold a city council public hearing to determine the zone text amendment. The zone text amendment is exempt pursuant to sections 15060 C2 and 3 and 15061B3 of the California Environmental Quality Act. Regulatory actions which will not result in direct or reasonable foreseeable indirect physical change in the environment, and when it can be seen with certainty that there is no possibility that the activity in question may have a significant effect on the environment, are not subject to CEQA. Staff's recommendation is the following: that the Community Services, Public Safety, and Housing and Development Committee receive a summary report on a potential zone text amendment to Chapter 16 of the Oxnard City Code to include medical clinics and hospitals within Section 16-10, which is definitions, and include medical clinics and hospitals as a sensitive use requiring a minimum separation from firearm and ammunition sales and firearm ranges uses within Divisions 19 and 20 of Article 5. For the committee to provide input on the proposed definitions for medical clinics and hospitals, and for the committee to determine if staff should pursue a zone text amendment to Chapter 16 of the Oxnard City Code to include medical clinics and hospitals as a sensitive use requiring a minimum separation from firearm and ammunition sales and firearm ranges uses within Divisions 19 and 20 of Article 5. This concludes staff's presentation, and staff is available for any questions. Thank you.